Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be discussing a condition that affects millions, particularly women. It's called hyperthyroidism. The condition doesn't just speed up the body, it impacts your heart, your bones, your mood, and even your eyes. Whether you're experiencing unexplained weight loss, anxiety, fatigue, hyperthyroidism could be the underlying cause. To explore this topic further, I'm joined today by Dr. Bryn Henderson. Dr. Henderson is a leader in innovative and regenerative medical therapies. Today, we're going to discuss hyperthyroidism, why it occurs, how to treat it using both traditional, modern approaches, and Chinese medicine. Dr. Henderson, thank you for joining us today. Let's start at the very beginning. What is hyperthyroidism?
Well, thank you, Dr. Pinsanti. Hyperthyroidism is when the thyroid gland produces too much thyroid hormone. That speeds up the body's metabolism, which can lead to symptoms like weight loss, fast heart, tremors, sweating, anxiety, and of course, fatigue. One of the most common causes is Graves' disease, an autoimmune condition where the immune system mistakenly attacks the thyroid.
Is this something that runs in families?
Yes, there is a strong genetic component, particularly in Graves'. Certain gene clusters are associated with a higher risk. If you have a parent or a sibling with hyperthyroidism or an autoimmune disease, your risk is higher.
What about before birth? Are there reasons during early development that might make someone more susceptible to get this?
The thyroid gland starts forming in the throat area before birth, then moves down to the spot in the neck. If something affects this process, it can sometimes lead to thyroid tissue being in the wrong place or to changes in how the immune system sees the thyroid. If the immune system doesn't learn to tolerate it properly, it could later attack the gland and cause medical conditions.
So, traditional Chinese medicine, what do they do about it?
Traditional Chinese medicine is often linked to the yin deficiency and heat syndrome. It's associated with disharmony in the liver, heart, and kidney meridians. Acupuncture points may be used to regulate qi, calm the spirit, and cool internal heat. Several herbal formulas have shown promise in randomized control.
So, how is hyperthyroidism typically diagnosed today in our clinics?
We start with blood tests. A low thyroid stimulating hormone and a high free thyroid 4 or 3 levels confirm the diagnosis. We also use the receptor antibody tests that are known in the blood to detect and measure the presence of antibodies that bind to the thyroid stimulating hormone receptor.
So, this TSH receptor antibody test is a blood test,
Yes.
like the same as when you have your thyroid tested?
Yes, ma'am, it is. It identifies Graves' disease. If you want, you can even perform imaging like radioactive iodine and things. There are uptake scans that help determine the cause. In some clinics like ours, we may also use brain mapping because a QEEG, when patients report mood or cognitive symptoms, frequently points to the underlying cause being metabolic.
All right, what's standard of care treatment for hyperthyroidism today?
We usually begin with anti-thyroid medications. PTU is probably the most common, but it's used before thyroid surgery and especially before the radioactive iodine treatment. So they consider radioactive iodine or a thyroidectomy only if needed. However, many of these approaches lead to permanent hypothyroid, So we also explore adjunctive regenerative therapies in carefully selected patients. We're currently evaluating regenerative cells, particularly immune modulating stromal cells or thyroid supporting progenitor cells, to help restore immune tolerance and create a better balance in the support tissues. Exosomes, especially those derived from the mesenchymal stromal cells, can deliver anti-inflammatory signals and modulate overactive immune pathways. There's also specific peptides such as thymosin alpha-1, which helps regulate immune function and may promote immune tolerance. And of course, BPC 157, it's a healing peptide.
Are there any risks or contraindications to these newer regenerative therapies that you are using right now?
Yes, in uncontrolled hyperthyroid, especially, there's what they call thyroid storm. And these therapies should not be used unless you understand the risk of exacerbating the systemic inflammation. We only consider them in stabilized patients and always under close monitoring with full transparencies about their investigational nature.
So most people have probably heard it called Graves' disease. So if someone has been diagnosed with Graves' disease or hyperthyroidism, what can they do at home?
Lifestyle plays a huge role there. They need to avoid iodine-rich foods. They need to reduce the caffeine and the alcohol. They need to get adequate calcium and vitamin D to prevent the osteoporosis. Practicing various stress reduction techniques like mindfulness or yoga is also recommended. And following a good sleep hygiene is imperative since insomnia is very common. Patients should also stay hydrated and monitor for heat intolerance.
How do you monitor your patients in your office?
We check the thyroid panel first that has thyroid stimulating hormone, T3, T4, all the various parameters of thyroid in the blood. If the patients undergo or they have undergone any radioactive iodine therapy or surgery, then we have to monitor them for low thyroid, hypothyroidism. And that usually means you adjust a levothyroxine medication as needed. We also assess TRAB levels, which means thyroid restrictive antibody levels in Graves' disease to predict relapse. And we keep an eye out for complications like atrial fibrillation, osteoporosis, and mood disorders.
What is the long-term outlook for patients with hyperthyroidism?
It depends upon the cause and the treatment. About 30 to 50% of the patients with Graves enter remission with medicines. It's good. But relapse is common. And you need to get the quality specialists on board, especially if they have protruding eyes or something that requires an ophthalmologist. And that is essential for long-term eye health.
All right, let's talk about your mnemonic to help patients. What's it called?
Oh, you could guess it. It's thyroid.
All right, T stands for?
TSH and hormone levels.
H.
Hypothyroidism monitoring post-treatment.
Y.
Yearly TRAB checks.
R.
Refer for eye symptoms.
O.
Observe for relapse.
I.
Imaging if nodules are suspected.
And D.
Drug safety labs, CBC, liver function tests, etc.
Well, thank you, Dr. Henderson, for enlightening our audience with this discussion on hyperthyroidism or Graves' disease. If you or someone you love is feeling fatigued, anxious, losing weight, and we didn't talk about the skin feels like velvet on these patients. Hyperthyroidism is manageable, especially when caught early and approached with a comprehensive plan. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.